Good afternoon. Thanks for joining me today. My name is Heather Austin. I'm a licensed and practical nurse here at Essex Family Health, and I am here to talk about implementing an alert system for our electronic health records. So here's the presentation agenda. I'm going to first go over the current electronic health record and how there's some risks to patient safety, particularly with disjointed continuity of care, unmet patient display needs, and high error, which results in patient safety being costly. And I'm going to go over the solution, which is an alert system to highlight pertinent information that healthcare providers may use and can use. And then I'm going to go over the project budget and end with a few statements. And then we'll open the floor up for any questions that you may have. So the first thing I'm going to talk about is the fact that there's, again, the broad problem is that the electronic health records, there's a high risk of patient safety without an alert system. There can be a just disjointed continuity of care, which can result in misuse, miscommunication, or just simply software incompatibility with the differing doctor's offices or hospitals that we may have contact with. This can result in dangerous breaks in the continuity of care, which threatens the patient safety. From the New England Journal of Medicine, one of these examples was a prescription was written out for 30 milligrams of oxycodone, sustained release, and it was mapped to 30 milligrams of oxycodone, immediate release, which was incorrectly dispensed and could result in a threat to patient safety. Secondly, there is a need for an alert system because of unmet patient display needs. As we know, electronic health records have a ton of information, patient information displayed on it, either by tabs or very quickly on the dashboard, which is the main profile page when you first log into an electronic health record in a patient's chart. This information, these are information that range from medical diagnoses to treatments to laboratory values to advanced directives to all this pertinent information that may be useful when evaluating or assessing an individual. This information, however, because there's a multitude of information, can be overlooked or missed. Which results in a very, very high threat to patient safety, very high threat. An example of this was from the GMS Health Technology Assessment Journal by V.L. Raposo, who reported that a patient's treatment was delayed, and this is cancer treatment. This was delayed because the system referred to an older exam rather than the most recent exam that was conducted. And this older exam did not have any abnormal results. So therefore, the doctor, instead of being referred to the most recent exam, was not alerted to the fact that cancer treatment needed to be begun and to be started. So therefore, this person that had a very high risk to patient safety, very high risk of their life being shortened as well. The third and final ramification of the current electronic health records, or EHR, as we all know it to be, is that there's a high cost of error, and therefore there's a high cost of patient safety. As you can tell, patient safety is the theme. The problem is a high risk to patient safety. Sue Bauman, she is the Senior Director of Compliance and Coding at the American Health Information Management Association, or AHIMA. and she writes about coding and proper coding and the cost of error. She wrote that 84% of progress notes contained at least one documentation error, with an average of 7.8 documentation errors per patient. That is a lot of erroneous material that can be decreased with a little bit of structure and a little more guidance. All three of these ramifications and the basic broad problem of high risk to patient safety of our current electronic health records is to add an alert system to the electronic health record to highlight pertinent information to clinicians that are using it, including administration staff, as well as doctors and nurses. This will be able to alert the doctor or the nurse to some medical diagnoses that may possibly be overlooked, as well as possible laboratory results that may be on the verge of being abnormal, just for a review. Now, again, the alert system is not to take away from the education experience and the clinician experience. It is just a tool to help for a busy day when clinicians may overlook some information. With this alert system, an upgrade to the electronic health software would be beneficial, and providing touchscreen laptops and iPads that allow the ability to tap for rather than using a mouse will increase the efficacy and therefore increase patient safety. So before I talk about the equipment involved, I just want to restate how an alert system would make this organization and this clinic a more efficient and also a safe and trustworthy office for patients to choose. An alert system would unionize the continuity of care by alerting the clinician to a specialist's note or a doctor's office, a previous doctor's visit, or any information that may be overlooked by the human eye or by the system. It would alert that individual to that information, and therefore increase and unionize the continuity of care between the pharmacy, the hospital, the doctor's office, the specialists, and within the doctor's office itself. And with the current upgrade to eClinical, we have eClinicalWorks 9, version 9. If we upgrade to eClinicalWorks version 10, we know we have the most recent and the most reliable software for the alert system. And the alert system, then we can evaluate whether the alert system is working or whether it's not working efficiently. And finally, adding some other equipment would help with the efficiency and therefore time of the clinicians, which also increases the safety and the trustworthiness of patients as well. So therefore, touchscreen laptop, the clinician would be able to, at the touch of a finger, be able to tap onto the alert, and it would be able to bring it to the alert, and then they can slide with their finger to kind of review the information, as well as potentially write anything in, which is more effective because rather than using a mouse, because you have to take time to figure out how to manage and how to get to the information that you need. Another piece of making the alert system a little more efficient is to have portable technology, which in this case, I recommend an iPad that is portable. It's a little tablet. It is efficient in that clinicians can grab it and acknowledge the alert, review the information before and while walking to the patient's room or standing right outside the patient's room and quickly reviewing the information and acknowledging the pertinent information that the alert system has alerted the clinician to. Therefore, the iPad will also not only increase patient safety, but also increase patient trust because it's at the tip of the clinician's fingers, and it will increase the ability to review the information right before going into a patient's room. In order to make this project work, there is a budget of $250,000. A multitude of that is the $110,000 for vendor costs, which includes the alert system implementation, as well as the upgrade in the EHR system. Also, there would be a firewall installed for software and hardware just to add added security, which would be $8,000 to install. The equipment, which is the iPads and laptops, 10 of each, would be $9,600. Personnel would be the IT specialists that we would need in order to install and implement the alert system, as well as the most recent EHR system. And that would be $100,400. And then training sessions would be $12,000 because we want to make sure that we're giving the clinicians enough time to properly use the alert system at its most highest benefit. In conclusion, implementing an alert system, upgrading the electronic health records to the highest, most recent software, and providing training sessions as well as laptops and iPads for the clinicians. The benefits to have an alert system is improved efficacy in not only the clinician's practice, but the whole office as a whole, as it will improve the continuity of care within the organization, as well as outside of the organization in the other healthcare realms, again, such as hospitals, specialists, pharmacy, laboratory as well. And this promotes a higher quality of safety, which will increase patient trust, increase patient safety, and also promote business by having patients recommending and desiring to come to a clinician. We get our name out there, we get told that we get high reviews, that we are a facility and we are an organization and we are a clinic to trust. Thank you very much for the opportunity to present this information to you. I hope it was as invigorating as it is to me. I really believe that an alert system that highlights pertinent information will increase our chances for improving quality care and patient safety and promote patient trust. I am open for any questions that you may have, and I will answer them to the best of my abilities. And thank you very much.